Hi, my name is Katie Judd, and we're going to talk about how medication affects mental health disorders in the brain and the future of treatment through magnetic stimulation. This is how the brain communicates. Neurotransmitters or chemical messengers are released and received by the brain's many nerve cells called neurons. Neurons are constantly communicating. This system is essential to all of the brain's functions. Mental health disorders, such as clinical depression, often have increased levels of monoamine oxidase A, an enzyme that breaks down key neurotransmitters, resulting in very low levels of serotonin, dopamine, and norepinephrine in those affected. Low levels of any of these chemicals can result in deterioration of mental health, which can be a major impediment in a person's daily life. Taking antidepressants or going to psychotherapy can help in balancing these neurotransmitters. While taking antidepressants have been effective for some, many studies show that there are many more healthy alternatives for the brain. Drugs are chemicals that affect the brain by tapping into its communication system and interfering with the way neurons normally send, receive, and process information. However, drugs alter the brain's chemistry, which may lead to a dependency and sometimes unpleasant side effects. And when you take a medication or drug, the entire brain is affected rather than simply the part of the brain that needs regulating. Being able to single out that one area of the brain affected by mental disorders would make for a more universal treatment. The future for treatment of mental health disorders may be magnetic stimulation, which is currently still being researched. This would be a personalized treatment, only stimulating specific parts of the brain. One form of magnetic stimulation that has been developed in recent years is transcranial magnetic stimulation, or TMS. TMS has been used as a treatment for people with major depression who have failed to respond to at least one antidepressant. The procedure involves placing a non-invasive machine against the scalp, which then sends short but intense magnetic pulses into the brain, where they generate an electric current. The pulses are centered over the left prefrontal cortex, an area that often shows abnormal electrical activity in patients with depression. A typical course of TMS therapy involves 20 to 30 sessions, generally given into 3 to 5 treatments per week for 4 to 6 weeks. The theory is that when this stimulation occurs in the left frontal brain, it spreads into the underlying deeper areas of the brain that are involved in regulation of mood. When done repeatedly at regular intervals, it normalizes the neuronal circuits involved in depression. There's a huge domino effect that comes along with this. If we are able to understand and cure mental health disorders such as depression, anxiety, and ADHD, we will open a new doorway to understanding how the brain works. We will also be able to help alleviate many of those who suffer from a range of mental health issues, saving them time, frustration, and allowing them to engage into the world around them. Magnetic stimulation is still a very new technology, and with more research funding, we could help the hundreds of millions of people worldwide who suffer from mental health disorders.